Back in the day, people pretty much used anything as medicine. Over the years, there have been some strange and simply disturbing methods in medicine used to treat people. This video is going to look at some of the strangest and sometimes deadly medical practices that were actually used. Bloodletting. Bloodletting was one of the most common medical practices from ancient civilizations, all the way into the 1800s. If someone had a fever or inflammation, doctors assumed there was too much blood in the body. To fix this, they would cut a vein with a lancet or apply leeches to draw blood out, sometimes removing large amounts in one session. It was used for a huge range of conditions, from infections and headaches to mental illness. The reason it persisted so long is that patients sometimes did feel temporary relief, but this was likely due to the reduced blood pressure or even the placebo effects. However, in the majority of cases, it weakened them significantly. In extreme situations, such as the treatment of George Washington, heavy blood loss may have worsened the illness rather than cured it. In some cases, patients lost so much blood that they went into shock or died shortly after treatment. Despite this, the practice remained trusted for centuries because it aligned with the dominant medical theories of the time and lacked strong scientific opposition. Maggot therapy. Maggot therapy sounds disturbing, but it has a surprisingly logical basis and has been used since ancient times. Doctors noticed that soldiers whose wounds became infested with maggots sometimes healed better than those without them. This led to the intentional use of sterilized maggots placed directly into wounds. It was primarily used for infected wounds, gangrene, and ulcers. While it faded with the rise of antibiotics, it has made a comeback in modern medicine in carefully controlled situations where other treatments fail. Today, the maggots used are specially bred in sterile environments to ensure safety. Although it can still make patients uncomfortable, it is considered an effective last resort treatment in certain severe cases. Electrotherapy. Early electrotherapy became popular between the 1700s and early 1900s, a time when electricity was still for the most part mysterious. Many scientists and doctors believed electricity was a kind of life force that could stimulate the body's natural healing processes. As a result, it was used to treat a wide variety of conditions, including paralysis, depression, chronic pain, and fatigue. Patients would be exposed to electrical currents through early machines, sometimes experiencing tingling or muscle contractions. Although they didn't necessarily understand how it worked, the fact that there were visual effects like the body twitching was convincing enough to make them think that it worked. In some cases, this method would lead to cardiac arrest because they were used as treatment on people who unknowingly had pre-existing heart conditions. This early experimentation eventually contributed to modern treatments such as electroconvulsive therapy. However, in its early days, electrotherapy was often applied without clear guidelines or safety standards, and they didn't use anesthetics or muscle relaxants. Some devices were even marketed directly to the public, leading to a lot of misuse and many exaggerated claims about how effective they actually were. Snake oil. Snake oil remedies became especially widespread in the late 1800s and early 1900s, particularly in North America. Traveling salesmen promoted them as cure-alls for pain, arthritis, and general weakness. However, most products sold at the time didn't contain real snake oil at all. Instead, they were made of cheap substitutes like mineral oil mixed with flavoring. What made this particularly dangerous was the fact that in many cases, these salesmen would put toxic amounts of minerals like lead or mercury, as well as arsenic instead. In some cases, they would also put addictive substances like high amounts of alcohol or even cocaine and heroin. Doctors and consumers believed in them partly because of persuasive marketing and partly because medical regulation was minimal at the time. Eventually, increased regulation and scientific testing exposed these remedies as largely ineffective, leading to the term snake oil becoming synonymous with fraud. Lobotomy. Conditions like schizophrenia and major depression were poorly understood and often left patients institutionalized for life. Doctors believed that these disorders were caused by faulty connections in the brain, particularly in the frontal lobes. The procedure involved surgically cutting these connections, sometimes by inserting an instrument through the eye socket and sweeping it through brain tissue. It was thought that disrupting these pathways could reduce distressing symptoms. While some patients did become calmer, this often came at the cost of personality, emotional depth, and cognitive function. The procedure was heavily promoted by Walter Freeman before eventually being abandoned as its harmful effects became clear. Many patients were left permanently disabled and unable to live independently. As more humane and effective psychiatric treatments were developed, lobotomy came to be seen as one of the most controversial practices in medical history. Smoking. The idea of smoking to treat asthma was common from the late 1800s to the mid-1900s, and it may seem especially strange today. At the time, however, certain substances used in asthma cigarettes, such as stramonium, were known to relax the muscles of the airways, which could temporarily make breathing easier. Doctors and patients interpreted this short-term relief as proof that the treatment worked. Tobacco companies also heavily marketed these products, reinforcing the belief that smoking could be medicinal. Unfortunately, while it may have provided brief symptom relief, smoking ultimately damages the lungs and worsens respiratory conditions over time. Many patients likely became dependent on these products without realizing the long-term harm. As medical research advanced, the link between smoking and lung disease became undeniable, leading to the decline of such treatments. Cow dung. The use of cow dung for wound care has roots in ancient and traditional medicine systems and was fairly common in certain regions. It was primarily used in India and some African communities and was believed to have natural healing or antiseptic properties. People applied it directly to cuts, burns, or infections, often as a paste. The reasoning came from observation and tradition rather than scientific testing. While there may have been occasional minor benefits, the overall risk of infection from harmful bacteria far outweighed any positive effects. In many cases, applying it to wounds likely made conditions worse rather than improving healing. Although it has been widely discontinued as a medical practice during COVID-19, there was a surge of people using cow dung to try to treat the disease in India. However, medical professionals assured the public that this was not a good treatment method. Tapeworm diet pills. Tapeworm diet pills appeared in the late 1800s and early 1900s during a time when weight loss solutions were in high demand and not well regulated. They were surprisingly common, as the logic behind them was simple. If a parasite lives in your intestines and consumes nutrients, then you would absorb fewer calories and lose weight. While this idea had a certain crude logic, the reality was far more dangerous. Tapeworm infections could lead to malnutrition, abdominal pain, and serious complications, making this an extremely risky approach to weight loss. In some cases, the parasites could grow quite large and would sometimes blockages and other internal problems such as nausea, vomiting, dementia, or even death. Medical professionals strongly warned against such practices as understanding of parasitic infections improved, and it is now illegal to sell this kind of product in the United States and other countries.